Congratulations, and what is your assignment? What's the job?
Well, on the most basic level, the three companies, Amazon, Berkshire Hathaway, JP Morgan, have a little over 1 million employees and families that they provide care for. And that system of care that they observe doesn't work the same way that we feel it doesn't work in the rest of society. The best way to put it is they recognize, just like everybody else, we're putting 18% of our economy into healthcare. But we have pretty good evidence that about 30% of it is to no benefit of the patient and often to the harm of us as patients. So, you know, it is amazing to me that I would get to partner with people like Jeff Bezos, Warren Buffett, and Jamie Dimon. Amazing people who have committed themselves to the long term. But the largest concept here is that I get to have 1 million patients that I, as a doctor, get to add to my responsibility. And my job for them is to figure out ways that we're going to drive better outcomes, better satisfaction with care, and better cost efficiency with new models that can be incubated for all. That is a tall frickin' order. But, you know, what they're saying for me is resources won't be the problem. Human behavior will be, and achieving scale will be. And I couldn't be more delighted.
Is the goal to, of course the goal is as you described, but is it also to set up a model that could be emulated in many other places, broadly, nationally around this country?
Absolutely. So number one, it is an independent entity. It is not part of those companies. Number two, it is nonprofit. There is no dollars that go back to those companies. That's really important because the only mission and the only goal then from the investment is that we achieve those three core goals: better outcome, better satisfaction, and better cost efficiency. And then my whole career has been committed to scalable solutions for better healthcare delivery everywhere. And so the core of it that I've always believed is that this is not just a US problem, that when we look all over the world, the inability to connect the dots, medicine has become so complicated that we have basic problems in the way we practice that can be overcome, and that we can arrive at a way that healthcare practice is much more about simply achieving the right care in the right way for the patient every time. And I think they've connected with me because that's been my work all along. So I've been able to add the mission that I've been building in my public health career to this group of patients.